Good morning. Welcome to Sports Radio 1310, The Ticket. George DeJohn, Train Station Fitness Show. It's 7 o'clock in the morning. It's dark out, but get up because you need to hear this information. Got Dr. Jeremy Webster in the studio co-hosting with me today. I've got a doctor who will be on the show. His name's Dr. Steven Rosenberg. He's from Philadelphia, and he's considered the foremost respected behavioral psychotherapist in the East Coast. Yet he wrote a book called, I don't know if I'm going to say this correctly or not, but it's called The 15-150 Secret to Simple Dieting. And he claims to have the calculation or scientifically proven way to eat. A calculation of, I guess, macronutrients, the protein, the fat, the carbohydrates, the ratio that he said is the perfect ratio to have for not only fat loss, but for permanent fat loss. Now, there's a lot of doctors that can claim these things. It's not necessarily true for everyone. I've said since the very beginning, over 14 years ago, that no one doctor can write a diet book. It can't be done. Can they help thousands of people? They certainly can. But will they help everyone? No, it can't be done. Dr. Webster, chime in on that, please.
Yeah, you know, I'm both. There's two emotions that I have right now about this book. One, I'm skeptical because the claims are pretty outlandish. But also, when looking at the claims that he's making, I'm very excited to hear what he has to say because this seems to be something potentially new and potentially something that people can use.
He said all diabetics, and just comment on this briefly, all diabetics get an A1C level of a non-diabetic, and he said no one else can do that. Why does that get in your craw?
Well, only the no one else can do that part, because I test that on everybody and I can do it.
Well, what is it?
Well, A1C is measuring the damage done to your red blood cells, basically the hemoglobin. And it's measuring the damage that's being done to excess blood sugar or the lack of antioxidants that protects those blood cells. So a diabetic having higher blood sugar has more damage done to the blood cells, therefore their hemoglobin A1C goes up. You want that level to be low.
So this is not a show for diabetics. It's not a show for people who have any particular condition. It's one where I guess the reason I'm bringing this show to you today is not to prove Dr. Rosenberg right or wrong, as much as it is we are in a time of the year where everybody says fat loss, they're going to do certain things, these resolutions to lose fat, get in shape, and blah, blah, blah. And they're bombarded with infomercials, CDs, exercise equipment, new diets. And what my role is, and I don't know about you, Dr. Webster, I'm not going to speak for you, but my role is to, and always has been, to expose the truth. So you either buy the CD, the book, the exercise equipment, or you don't.
Right. And let me make this statement. That A1C, the statement he made about the A1C actually is something that excites me, because the fact that he's measuring that and he's getting positive results in that area is very exciting to the health of every single person that's listening.
Okay, so we'll talk with Dr. Rosenberg in his new book that claims to be scientifically proven for fat loss and keeping it off. 705 Sports Radio 1310, The Ticket. 713 Sports Radio 1310, The Ticket. George DeJohn, Train Station Fitness Show. This is one of those shows where, since we're in this time of year, by the way, Dr. Webster's with me this morning. Hello. This is one of those shows where it's that time of year, like I mentioned earlier, and so many people are looking for something, the quick fix, the end-all, be-all to whatever their goal is when it comes to health and fitness.
Anything to motivate them, too.
Anything to motivate them. And it's like, there's even things that people do where they know that something's kind of sketchy, like the goofy Hollywood diet. You don't eat anything, you just drink this whatever. And they'll do it, and they know it's not good for them. But I think what you have to do, and I mentioned this several weeks ago, is make sure that any eating plan you're going to use is a sound eating plan that when you finish the required amount of days, weeks, or months on it, that you're actually not veering off from the eating plan because it's one that you're supposed to continually use. But right?
Good point, yeah.
Right? But now you introduce other things into that eating plan and you make it an overall well-rounded plan.
So what you're saying is Oprah's salad and mint diet is not something that you'd want to do
I
long
didn't
term?
even know anything about that. Don't give me a headache this early in the morning. So, co-hosting with me today is Dr. Webster, and on the show on the phone is going to be Dr. Rosenberg, who wrote a book, The 15150 Secret to Simple Dieting. He even said that you can drink or have alcohol, if we're talking about drinking, and diet too. What is that about? Dr. Rosenberg, good morning.
Good morning. How are you today?
We're great. Say hello to Dr. Webster.
Hi, Dr. Webster. How are you?
Great, Dr. Rosenberg. Nice to talk to you.
Dr. Webster is a doctor of chiropractic and nutrition, and I wanted him to be on the show today because he's going to have a different perspective of your book and the ideas and be able to ask certain questions that I probably would not be familiar with. You said you have this proven way to eat for real fat loss. Tell us about the premise of your book, how you found the ratio, I'm guessing the proper ratio for fat loss of the 15150 Secret to Simple Dieting.
The basic principle that I discovered about 20 years ago when I was doing work in experimental biology, doing work with calorimeter experiments. And in calorimeter experiments, for people who are not familiar with it, you are actually burning foods, igniting foods in a chamber and seeing what energy is released from it. And in those experiments, and carefully analyzing different foods, especially high-fat foods and high glycemic index foods, we found that the ratio of complete burn in the body is 15 to 150. So that if you have 15 grams of fat per day, or even less, and 150 grams of carbohydrates per day, or even less, you are absolutely guaranteed to lose weight.
Now, when you say weight, let's qualify that.
Surely.
Because there are people, excuse me, who lose weight on a scale, but they're losing water, some fat, and muscle. And
That is correct.
when we lose weight, we want to be healthy. So we'd
That
like
is
to
correct.
lose fat and keep the muscle, and some people add muscle. Tell us about that.
That is correct. When you are losing in this particular situation, and this is only the first phase of the diet where you kickstart it. And so what you're doing is you are losing weight in all three areas. It's both fat as well as in some muscle situation as well as water.
But why do we want to lose muscle when that's the last thing we need to lose?
Okay, well, and on any diet, when you start with protein, you're going to lose a little bit of muscle. And that's very, very minimal. So that what you're going to do is you're going to stop that, and you're going to get into a situation where you're just going to be burning fat, and that's what the calorimeter experiments show.
Okay, Dr. Rosenberg, tell me a little bit before we go any further about the third macronutrient. You mentioned fats being less than 15 grams, 150 being the max for carbohydrate, but how much protein are you recommending on this diet?
We're saying to get as much lean protein as you possibly can. And we do not look at an exact number for protein, but I'd like to get a good amount of lean protein into a person's body.
So maybe on the order of 100 grams then.
That is correct. That is basically the base number that we're looking at.
Okay, and the reason I asked really was to see what the total calorie count was. Given the 100 grams or so, it looks like you're recommending approximately 1,100 to 1,200 total calories. Is that about right?
It goes to between 12 to 1,500 calories per day.
What concerns me is people who are, let's say, obese. Some may look at these people and say, wow, they don't burn many calories at all. But if you've ever seen somebody who's got these huge calves that support their body, usually on big men, that they have a great deal of muscle, although they might have 100 pounds to lose. These people are burning more than 1,200 calories a day.
Yes,
Yeah.
that's correct.
Okay, and the people who are need to have a certain amount of calories to sustain where they are or to lose weight. And often what happens, especially with women, if they're not having enough calories, regardless of the ratio, then they can't support that and they have trouble with their metabolism in a totally different avenue, don't they?
Right. And Dr. Rosenberg, speak to that, please, because I'm curious, like George is, how do you differentiate between a 140-pound woman who's only 5 foot tall, maybe her ideal weight might be 100 or 110 pounds, versus a 6'2" man who weighs 350 pounds? Those are two completely different beings. How do you differentiate between, are you telling them 15,
sure, yeah. Well,
15, 150 for both of those people?
That's a very good question. The startup of the program is you get down to, and you're watching, reading labels is the premise of learning how to eat properly. You read nutrition labels.
Well, people don't know what they're reading, though. We've been saying that for years. Read the
go
label,
over
they say,
that
okay.
with them completely. If you read the book, you see that.
Okay. I didn't get the book.
They're educated in reading labels. That's the first thing that people do. And on a 350-pound man, the book states very, very clearly that if you just cut back on your fat and carb consumption, that's great. You don't have to get to the 15-150.
Okay, there's a Dr. McCleary who was on the show, gosh, I don't know, a month ago or so, and he is a neurosurgeon. And he decided that he wanted to help his patients in another way, more powerful than what he was already doing, with his knowledge as a medical doctor. So he got a doctorate in nutrition. And he found the power of fat helping people to not only give you function, the brain, the function that it needs, but giving you the ability to lose fat, because if you're not eating enough of the appropriate fat, you're not going to lose fat. So is the amount of fat that you're recommending appropriate for everyone? Because some people, I don't want people to still be on that train of, oh my God, fat is bad for me, carbs are bad for me, I can't eat anything. Or if they look at the label, okay, the fat's low, that says no sugar, but it's got all these sugar substitutes in it that can cause fat gain. It just seems like there's this analysis paralysis that even I have to deal with when I look at all of this news. It's like, where do you start? How do you help people?
Well, that's very interesting, because you do need fat to function. There is no two ways about that. And as I said, when you are looking at an individual basis and you see that what a person needs to eat in order to feel satisfied, they do need fat in their diet. And I say to everyone that I see personally and also in the book, that what you want to do is to feel comfortable and satiated with what you are eating.
Right, but let me just interject for a moment, Dr. Rosenberg. As far as being satiated, that usually turns on the signal in our brain in about 15 minutes, right? And if people have leptin issues, that's a whole nother issue. So they're not going to feel satiated. How do you deal with that, regardless of the ratio?
Well, the ratio is basically going to help the person to fine-tune their eating. That's the purpose of the ratio. You reach the levels that you feel comfortable with. When you get rid of the inflammatory saturated fat in your diet and the inflammatory high glycemic index foods, you're going to feel very, very good. Plus, you're going to also feel nutritionally sound. And that's an individual basis. You feel it. Everybody feels if it's comfortable for them when they're on an eating program. You need to feel comfortable and listen to your body.
Dr. Rosenberg, I know on this show we talk about things like this a lot. We've talked about Paleolithic diets and different ratios, even the Atkins diet. Not that we're advocating an Atkins type diet, but I know I've at least kind of tended towards thinking that everybody needs their own individualized ratio. Can you tell me a little bit about that? Do you think that everybody works best at this 15 to 150 ratio, or is there room for maybe customization, whereas certain people, depending on maybe their genetics, need a higher percentage of fat and other people need a higher percentage of carbohydrate?
So before you answer the question, let's let you answer that after the break, because I want you to take that and make it more concise, Dr. Webster, that question. It's a great question. It's not one that's going to be answered in 30 seconds. So we'll come back more with Dr. Rosenberg in his book, The 15-150 Secret to Simple Dieting. Does Dr. Rosenberg, who is a behavioral psychotherapist, have the nutritional knowledge to help you to attain your fat loss goals? We'll find out more coming up next. 724 Sports Radio 1310 The Ticket.
The Ticket.
731 Sports Radio 1310 The Ticket. George D. John, Train Station Fitness Show. The sun is out. It only took us a half hour to get there. Dr. Webster's in the studio with me, and my guest is Dr. Steven Rosenberg, behavioral psychotherapist. One of the things I didn't ask you, Dr. Rosenberg, is I know you wrote the book, The 15 150 Secrets to Simple Dieting, but how did you gain the nutritional knowledge if you're a behavioral psychotherapist? Listen to me, psychotherapist. I think I need your help after this, your services after the show. But how did you gain the knowledge of nutrition with that profession?
Yes, I'm a certified nutritional counselor. I've had the coursework. I've taught nutritional counseling, so very well adept at nutrition and what to do with eating situations.
Okay. Dr. Webster had a question for you before we went to a break.
Yeah, and really it just has to do with customization. I know we've done some genetic testing even that's real specific as far as what type of ratios that people tend to need depending on where their ancestry is from. For instance, if you're a white male and your ancestry is primarily from Southern Europe, where there's more vegetation available, maybe you need a higher percentage of carbohydrate versus fat. Whereas if your ancestry maybe is from far northern Europe, where they eat walrus and blubber and whale and all, seal and stuff like that, and they don't have the vegetation available, maybe a higher fat percentage might be more appropriate for you. So can you talk a little bit about the potential for customization, or do you feel like everybody needs to be in this strict, basically 1-to-10 ratio of fat to carbohydrate?
No, the situation is that it is very customized for the individual. We ask people to really look at what they are currently eating and just look at eating more, quote, healthy foods that fit their lifestyle. If they're used to a higher fat situation, then we say to them, go ahead and do that and look at lowering your carbohydrate intake. If you're used to a high carbohydrate situation, lower your fat intake. Just work the situation to balance what you are doing so that you are feeling really comfortable with what it is you're eating. And also in the fact that you're having proven results. Make sure that you're really getting in tune to a situation that is both comfortable for you culturally as well as physiologically. And you must listen to your body.
Dr. Rosenberg, one of the things I wrote, I often write certain things on Facebook, and I'm going to it now on my phone, that are thought-provoking and help people, I hope they help people, to get to a place where they can sustain a consistent way of doing something that's positive for them. Being a behavioral psychotherapist, would you agree that even even if there was one diet, eating plan, whatever you want to call it, for everyone on the planet to use, that those who don't respect themselves, don't have the self-love, will find a way to sabotage it, so basically it's kind of a moot point?
Well, I guess you didn't read my book.
No, I was not given your book, Dr. Rosenberg.
Okay.
We went through this, you and I, on Tuesday.
And online if you wanted to. The situation is that we have a chapter basically devoted to that particular thought. And the chapter is chapter 3, self-limiting beliefs. And we show the person how to mentally get themselves out of that negativity of that self-limiting belief. Readiness is the only thing that will stop a person from doing what they want to do. If you are not ready to do something, you will never, ever do it. So therefore, what you want to do is to read chapter 3 and decide whether or not you're ready to embark upon this healthier lifestyle.
Okay, so if someone, we often find, whether you're a trainer, nutritionist, a doctor, someone will ask you, what is the best exercise for this? What is the best eating protocol for that? How do I love myself? Whatever the question is. And when you give them the answer, if it doesn't align with what they want to hear, they will either become defensive or say yes, 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 and not do anything about it. Someone may buy your book, and I hope they do, and look at this part about the limiting belief section. How does what you recommend in the book make an emotional impact on someone so they do, give themselves a way to have a sustainable or consistent way of treating themselves? Or is it only about choice? You're either ready or you're not, and basically put the book down if you're not.
No, that's not correct either. In fact, what we go into is meditation. So that I ask people, to look at themselves introspectively, and we teach meditation in the later chapters to show how to get that mental state and get ready to do something. Everybody knows that they want to improve their life in some way, shape, or form. And so through meditation, I show the person how to get into that state of mind where they are ready to improve their lives. Whether it is weight or whether it is something else, it is an improvement in the way they are living.
Dr. Rosenberg, you made a statement that caught my attention. You said all diabetic patients get a normal hemoglobin A1C level. Can you talk a little bit about that? But I also want you to talk about other factors that might improve when patients follow this diet. For instance, do they feel like they have better energy? Do their triglycerides come down? Does their cholesterol come down?
Cravings.
Or up? Or cravings? What other factors also do you see are consistent in your patients or your clients who do this type of program?
Yeah, well, let's start with the diabetic patient. Personally, in my office, I've seen many, many hundreds of diabetic patients, and through the individual counseling that I give them, and through the book counseling that is in the book itself, they're able to drop their A1C level. And every single one of my private patients have dropped their A1C level to that of a non-diabetic person.
And when you say A1C, you're basically measuring the damage done by excess blood sugar. Is there anything
Correct.
else you want to say about that?
Well, you see, the excess blood sugar, of course, plays havoc on the entire body. So that when they are getting their A1C levels underneath that 6.0 is great. When they get it down into the lower fives, it's wonderful. And these people are used to A1C levels of 8.5, 7.8. And, they're having a tremendous amount of damage to their entire body internally with respect to the high level of the sugar level that they are carrying. It's incredible.
And Dr. Rosenberg, myself and some of my colleagues, we like to refer to the A1C test as the rate of aging test, because the lower it is, you tend to age. It tends to destroy your body or break your body down much slower. And the higher it is, it tends to kind of accelerate your aging process.
From a vanity standpoint, for especially for the women, if you don't want to have the injections, you're not interested in looking older, there's so much vanity that especially in where we live, but throughout America, if that's a concern to you, before you have that comfort food, usually sugar, you may want to think about how sugar kills the collagen and can make you look older, regardless of what it does to you from an inflammatory standpoint and maybe even attracting disease. How does it make you look older? Not even be older if you're measuring your age, but look older. You can't reverse that. Yeah, you can get some procedures here and there to help yourself look better, and I understand all that, but then you're spending more money just because you had the cupcake.
And it truly is amazing. When you get your sugar under control, a couple other things happen. Your insulin level goes down, but that makes your growth hormone level go up. Your skin looks better almost instantly when you get your sugar levels under control.
This is what we find. We find that there's a glow in these people that they haven't had before.
Yeah.
And when we talk about growth hormone, we know that when you have a higher level of growth hormone, a healthy level of growth hormone, you not only strengthen your immune system, but again, let's go back to the vanity point of view. Any efforts you're trying to make as far as fat loss on a diet or exercise are therefore enhanced by having a higher, healthier growth hormone level.
Certainly.
No question about that, too. I mean, you see a glow, and that's important, that everybody not only feels better, but they actually look better when they're under control with their eating situation.
There are many men who don't like vegetables and say, you know, I haven't liked them since I was a kid. Well, that usually comes down to conditioning. And what I found, shameless plug here on my cleanse, is that men after about 10 to 12 days begin to actually crave vegetables. And I think that goes for just about any sound eating plan. When you balance blood sugar, you change taste buds, you begin to crave the healthier foods. And people say, well, no, especially here's a woman talking, I'll always crave sugar. No, you won't always crave sugar. However, if you have something you liked before and you're not craving it, but you were to have it out of habit, emotional comfort, you'll still like the taste of it, but you may not be craving it from a physiological level. Can you comment on that, Dr. Rosenberg?
Well, without a doubt, you know, when you're eating a situation where you are getting away from all of the high glycemic index carbohydrates, the sugar carbs, the white flour carbohydrates, they are addictive because what they do in the brain is they create serotonin levels, so that you are constantly eating carbs and then you crash from them, and then you eat more to feel better. So that once you get away from those carbohydrates and you're eating differently and your taste buds do change, you absolutely feel better.
Did you know that you also crave sugar in your intestines? People tend to think that it's the brain that makes you crave sugar, but you can crave sugar during the digestive process, and how amino acids played in the sugar, or how they're broken down rather. I read this incredible study in the past couple of months, make you crave sugar from your intestines. Did you know that?
Well,
I was unaware of that, no, and that's an enlightening factor.
and I think a lot of it has to do with the fact that sugar just feeds the yeast that could potentially be in your gut. And when the yeast gets out of control, then it's gonna actually reestablish the way your brain perceives cravings and food, and force you to crave things differently. And you're gonna crave things like sugar and bread.
Right. The study said specifically, with let's take the brain away from it. You will crave sugar from a physiological level through the digestive system when you have sugar.
It's the second brain.
Second brain. It's exactly what they said.
The gastrointestinal system has a nervous system almost as complex as the brain in your head.
Dr. Rosenberg, coming back, what I want you to do is comment on something that I'm searching for right now. Apps for phones, smartphones. I have an iPhone I got December 23rd. I'm looking at some new apps. I'm looking for, and I want anybody who knows of the best app possible for exercise and eating. And I haven't found one yet that does this. And maybe you guys can not only help me, but everybody listening. You can find me on Facebook. Just put in George DeJohn or 21 Day Body Makeover. Or if you want to watch this show again, you can put in 21 Day Body Makeover in YouTube. I'll have it loaded today. But one of the things I'm trying to find, and I think a lot of people are searching for this, there's so many apps for exercise, is an app that shows movement, so some type of video of the person exercising. That's the first thing. The second thing is the muscle that it's using, which is not a hard one to find. The third thing is to be able to interchange or use the exercises I would like to have put into the app or taken out of the app. Because what I found on some of the apps is they have dangerous bodybuilder mentality exercises in there. They're old. And then also one that has eating where you can change the foods that maybe not be in there, where you can add a food that's not available in the app, and it might tell you the calorie breakdown, or you can put the calories in there and basically customize the app if it doesn't have what you want. Does this exist, number one? If anybody knows about it, please send it to me on Facebook. I'd like to find it right away. I've looked at iMuscle, iFitness. I've looked at several later, Lose It, and iMuscle seems kind of be the best one, but it's not anything to do with food. I'm asking this on the radio not for George DeJohn's needs as much as it is anybody who has a smartphone that wants an app to be able to follow and be accountable for on a daily basis. And use to your advantage for Dr. Rosenberg's book, for George DeJohn's exercise program, or the Cleanse, or Dr. Webster's programs. I know they're available, but my question to you, Dr. Rosenberg, is, number one, does it exist? Number two, will people follow it? Will it be easier? Is it a tool for them to carry around, or is it something that will add pressure, add stress, because they now have this and they have to be accountable? Or is it all about choice? Let's talk about that. Coming up next, Dr. Rosenberg and Dr. Webster, 746 Sports Radio 1310 The Ticket. 754 Sports Radio 1310 The Ticket. My guest on the station today is Dr. Steven Rosenberg. He wrote a book called The 15150 Secret to Simple Dieting. Also co-hosting with me is Dr. Jeremy Webster. I left all of you, or both of you, with this thought. Is there an app that's available that people can follow that has safe exercises, maybe even motion, ones where you can take the exercises out that don't serve you or not in your best interest from an integrity standpoint of your joints, and you can enter others in, and also one that within the same app has the ability to enter the foods that you need for yourself, maybe even to follow your book, Dr. Rosenberg. And if it's not available, someone needs to develop it. I'm not doing it, but can you guys comment on that? Do you think somebody would follow that, Dr. Rosenberg?
Well, I think that it's, again, choice. There are people who like to be organized, and it is an organizational tool to track what you are eating. There isn't one great app that is available for everything that you want to do. That is absolutely correct. And we do recommend a few of them, but they're limited. But
I have to disagree about one part of what you said. And that one thing is, you said you think that people like to, I'm going to use the wrong word because I don't remember what you said, but people like to be structured, I think is what you said. And
organized.
Organized? Okay.
Yep.
And I tend to disagree with that. Now, you see people on a different level and more often than I do, but I see people not wanting to be accountable for what they eat, almost what I call eating blindly. Mm-hmm. Does that make sense? They're eating blindly, and they don't know the calories that they're consuming, nor do they really want to know. It's like a girl who knows that she doesn't fit in a certain pair of jeans, but she looks good in the jeans when she puts them on because it's holding everything in, but doesn't want to take them off. Or she goes and puts a bathing suit on, but she has a towel around her when she's walking around the pool or something like that, thinking people aren't going to see that she's got weight to lose. And it's almost like, if I don't see it, it's not there. The little kid who puts his hands over his eyes in the corner and nobody can see me.
Yeah, and that's why I say that it's choice. There are certain people who like to be organized. I say everyone likes to be organized. But the person who enjoys being organized, that is very helpful for them.
And no doubt about it, when people know what they're eating, they have better success. I've seen this. I force all my patients to keep a log. And they say, when I actually wrote it down and was able to look at it, even though I knew what I was eating if I thought about it, when I wrote it down and looked at it, that was when I realized that I had a problem and that I was not eating the right thing. So I don't have an app to give you, George, but I know that is very helpful.
Yeah, when people get organized and they are seeing what they're eating, then they see what they've been doing. People aren't aware of what they're doing all the time, and that's very, very true.
But most people are sabotaging themselves on an emotional level. Do you think, and only you would know this out of the three guests or three people here, Doc, but do you think that if someone sees what they're doing from a caloric standpoint and or the type of foods, and let's say they go get blood work and their doctor says you're over fat and you're diabetic, that may create more sadness within them and make things worse?
Well, it depends on where they are emotionally in their lives. It's a very broad statement. If a person is ready, again, I go back to readiness. If a person is ready to do something, that blood work will really push them over to say, I'm going to do it.
Okay.
That's their report card.
Well, thank you for being a guest on the show. I thank you for your insight and your studies, and I hope people do look at your book and decide on whether it's for them or not, because like you said, it's about choice. Dr. Rosenberg, you have a great day.